Hi everyone, welcome back to our series on hypothyroidism and how you can actually get things corrected so you can feel good again. In our previous videos I talked about the typical story for a lot of our hypothyroid patients, what they come in with as far as symptoms, and also why they might be experiencing symptoms still even though they've had their thyroid regulated and they're put on medication and their numbers are normal. And then we talked about the typical symptoms of hypothyroidism and what they actually are. And here's the thing, you might have hypothyroid symptoms, but you might not actually have a thyroid problem, because some of these symptoms can be caused by other metabolic issues, and it's important for us to know what to look for. So today what I want to do is I want to go through the common pattern and flow of thyroid hormone in the body. This is a very common point of confusion for a lot of people. They look at lab work, they look at results that they get back from the doctor, and they see numbers and they see how it's evaluated by the lab, and they think it's the opposite of what it really is. So I want to clear up any confusion so that you guys are empowered to be able to look at your lab work and have a better idea of what's going on so that you can have a better discussion with your practitioner. And then in the upcoming videos, what I'm going to do is talk about the common causes of hypothyroid symptoms, both thyroid and not thyroid, so that you can appreciate the complexity of what might be going on with you. And then we'll follow up with a video on what I recommend as far as testing, the things that you want to be talking to your practitioner about, looking into, so that you can have that dialogue as well. And then that will wrap up our series on hypothyroidism. So let's talk about the markers for thyroid and how it works in the body so that you guys can have a visual and understand what the numbers actually are and what they mean. So the most common marker that's generally tested by doctors is TSH, that's thyroid stimulating hormone. It's actually not a thyroid hormone. It's not secreted by the thyroid. It is secreted by a gland in the brain called the pituitary gland. So this gland right here, the pituitary gland, secretes thyroid stimulating hormone, otherwise known as TSH. And what thyroid stimulating hormone does is it literally, aptly named, stimulates the thyroid to secrete thyroid hormone. And what is 95% of what comes out of the thyroid as thyroid hormone is T4. Some of you have maybe seen this marker on lab work. Some of you won't, because maybe it's not even being run. Sometimes just this alone is being run to evaluate what's happening with you as far as thyroid function. The reason why TSH is the one we look at more often as far as thyroid function is because it tends to be a more stable hormone to look at, because things fluctuate quite a bit in the system, you know, hour by hour, minute by minute. So, but T4 is the main hormone that gets secreted by the thyroid. It is in its form bound with in such a way that it's not activated yet. So it's going to come out as T4 and then circulate through the body and be activated in some other organs and tissues. So that allows it to be distributed fairly evenly through the body, because every cell in the body does need thyroid hormone in order to run its processes. And so T4, like I said, 95% of it is T4, which is the inactive form. And your active form, this is the form that the cells actually use, is T3, okay? And there's a very small percentage of T3 that comes out of the thyroid, roughly 4 to 6% will come out active, okay? And that kind of makes sense. Glands in general, when they secrete hormones, they're not secreting it all 100% in active form. Otherwise, the second it left the gland, it would be activating and being taken up and used by the tissues in the immediate area, and it wouldn't get distributed through the body. So T4 will get distributed throughout the body. What happens is the brain, that pituitary gland, this is all on a feedback loop, because the brain is constantly regulating the secretion of hormones from the other glands. So T4 gets secreted, and as that circulates back through the brain, that will tell the brain how much T4 is in the system, and that will tell the brain how to secrete TSH, whether we need to secrete more or secrete less. So here's where some of the confusion comes from. For example, if your thyroid is not functioning well and your T4 is low, so your thyroid is not secreting very much T4, it's on the low side of T4. The brain picks up the fact that you have less than normal thyroid hormone, T4, and what it will do, it will increase its secretion of TSH because the brain is now trying to kick that thyroid up a notch to secrete more T4. So if T4 is low, which means low thyroid function, then TSH will be high. So high TSH is indicative of low or hypothyroidism. Some patients, they look at their blood work and they see TSH is high and they think they're hyper or they have high functioning thyroid. This is the opposite, right? So low functioning thyroid will end up leading to high TSH, and high TSH tells us you have low functioning thyroid because the brain is really trying to kick that thyroid up to secrete more, okay? The opposite is true if you are hyperthyroid. So if your thyroid is overproducing, or for whatever reason you have a over amount or a high amount of T4, that feedback goes back to the brain and the brain says, whoa, thyroid needs to slow down, it's hyper secreting. So the brain will put the brakes on this by taking the foot off the gas, so to speak, and it will lower the amount of TSH that's stimulating the thyroid. So hyperthyroid or hypersecretion gets found on blood work to be low TSH. So if you see low TSH on your lab work, that is hyperthyroid, okay? It's not low thyroid, low TSH. So that's the confusion that a lot of people have. Now, as far as regular thyroid function, I just want to also talk about how and where this hormone generally gets activated, because that's going to be important in our upcoming videos when we talk about the causes of the various symptoms of hypothyroidism, okay? So T4, remember I said that's inactive, and 95% of what comes out of the thyroid is T4, and it's going to circulate through the bloodstream, through the body, and at various checkpoints, it's going to then be flipped and converted into T3, which is the form that is active that gets taken in by the cells and actually used by your DNA to produce the proteins that run your cell processes. So here's what happens. T4 passes into the liver, and roughly 60% of the conversion of T4 or activation of T4 into active T3, 60% of that conversion happens in the liver, okay? And then roughly, I'm below, aren't I? Roughly 20% is going to happen in the colon. And then the other 20% basically gets picked up and retaken back up into the system to wash out. It's almost like a checks and balances kind of system. So T4, 60% of it gets converted and activated into T3 in the liver, and roughly 20% gets converted and activated in the colon, and then that active hormone now gets distributed throughout the entire body's blood system and gets taken up by every cell in the body. I'm just going to really quickly recap the important points. So high T4 or hyperthyroid will cause the brain to lower the secretion of TSH. So hyperthyroid shows up as low TSH on your blood work. Low thyroid or low T4, low hypothyroid function will show up as high TSH on your blood work, right? So high TSH is indicative of hypothyroidism or low functioning thyroid. T4 is inactive hormone. 95% of what comes out of the thyroid is not active, it's in T4 form. T3 is your active hormone. The rest of what comes out of the thyroid is in the T3 or active form. Then this goes through the bloodstream and gets converted. 60% of it gets converted to T3 in the liver. 20% roughly gets converted in the colon and intestinal lining, and then the rest of it will actually be taken back up and junked. It's just sort of a checks and balances system. So that's basically the general flow of the important thyroid hormones to look at. I just wanted you guys to understand the basic flow of how that looks on lab work and how you actually really interpret it. In our upcoming video, I'm going to talk about the causes of hypothyroidism, and some of that will be based on these mechanisms here, so you can really appreciate it's a little bit more than just looking at TSH, right? Because lots of our patients come in with normal TSH and they're on their medication and they're still dealing with these crazy symptoms of hypothyroidism. And then we're going to talk about the most common cause of low thyroid, which we see clinically, and how that needs to be approached, and we'll talk about solutions, testing, and things like that to start talking to your doctor or endocrinologist or functional practitioner about doing. And so I hope this video was helpful in clearing up any confusions. If it was helpful, please give me a thumbs up below. Remember to subscribe to our channel. Share this with friends and family, because this is an epidemic as far as symptoms within this country. Lots and lots of people are dealing with hypothyroidism or symptoms of, and it's not being addressed and handled properly. And of course, any of our books are available on Amazon. All right, you guys have a great day, and check back for our next video in the series.